Which nutrient is most affected by prolonged exposure to light during food storage? A. Thiamine. B. Riboflavin. C. Niacin. D. Vitamin K. Answer, B. Riboflavin, vitamin B2, is highly photosensitive, breaking down when exposed to fluorescent or sunlight, especially in milk and fortified foods. What is the main function of parietal cells in the stomach? A. Secretion of mucus. B. Absorption of nutrients. C. Production of digestive enzymes. D. Secretion of intrinsic factor and hydrochloric acid. Answer, D. Parietal cells secrete hydrochloric acid for digestion and intrinsic factor required for vitamin B12 absorption. Which lipoprotein is responsible for reverse cholesterol transport? A. LDL. B. HDL. C. VLDL. D. Chylomicron. Answer, B. HDL collects excess cholesterol from tissues and transports it to the liver for excretion or reuse, preventing atherosclerosis. A patient following a low-residue diet should avoid which of the following foods? A. Applesauce. B. White rice. C. Whole grain bread. D. Eggs. Answer, C. Whole grain bread is high in fiber and residue, which can irritate the GI tract in patients needing reduced bowel activity. The process of denaturation of proteins is caused by A. Enzymatic hydrolysis. B. Heat and pH changes. C. Oxidation. D. Reduction. Answer, B. Denaturation alters the protein structure through heat or pH without breaking peptide bonds, affecting texture and solubility. Which hormone regulates calcium levels by increasing calcium absorption in the intestine? A. Insulin. B. Calcitonin. C. Parathyroid hormone. D. Thyroxine. Answer, C. Parathyroid hormone raises blood calcium by stimulating vitamin D activation and increasing intestinal absorption. Which fatty acid is considered essential because it cannot be synthesized by the body? A. Palmitic acid. B. Oleic acid. C. Linoleic acid. D. Stearic acid. Answer, C. Linoleic acid, omega-6, must be obtained from the diet as humans lack the enzyme to synthesize it. The Harris-Benedict equation estimates A. Protein efficiency ratio. B. Basal metabolic rate. C. Total body water. D. Glycemic load. Answer, B. The Harris-Benedict equation estimates BMR based on age, sex, height, and weight, used to calculate daily caloric needs. What is the recommended first-line nutrition therapy for type 2 diabetes? A. Increased protein intake. B. Reduced carbohydrate intake. C. Low-fat, high-carbohydrate diet. D. Sodium restriction. Answer, B. Controlled carbohydrate intake and consistent meal timing help manage blood glucose in type 2 diabetes. Which of the following is a symptom of niacin deficiency? A. Dermatitis, diarrhea, dementia. B. Megaloblastic anemia. C. Night blindness. D. Peripheral neuropathy. Answer, A. Niacin deficiency causes pellagra, characterized by dermatitis, diarrhea, and dementia due to energy metabolism disruption. The main energy source for the brain under normal conditions is A. Fatty acids. B. Ketone bodies. C. Glucose. D. Amino acids. Answer, C. The brain relies primarily on glucose as its energy source because fatty acids cannot cross the blood-brain barrier. Which of the following tools best assesses body fat distribution? A. BMI. B. Waist to hip ratio. C. Skin fold measurement. D. Bioelectrical impedance. Answer, B. Waist-to-hip ratio identifies central obesity and associated metabolic risk better than total body weight alone. Which foodborne pathogen is most commonly linked to raw poultry and eggs? A. Listeria monocytogenes. B. Escherichia coli. C. Salmonella enterica. D. Clostridium botulinum. Answer, C. Salmonella is frequently associated with raw poultry and eggs and can cause severe gastrointestinal illness. The exchange list for diabetics categorizes foods by their A. Caloric density. B. Macronutrient composition. C. Vitamin content. D. Water activity. Answer, B. The exchange system groups foods based on macronutrient composition to help balance carbohydrates, proteins, and fats. A high potassium, low sodium diet is especially recommended for patients with A. Osteoporosis. B. Hypertension. C. Hypothyroidism. D. Anemia. Answer, B. Increasing potassium and reducing sodium helps lower blood pressure and supports cardiovascular health. What is the major storage form of carbohydrate in the body? A. Glucose. B. Cellulose. C. Glycogen. D. Starch. Answer, C. Glycogen, stored in liver and muscle, serves as a readily available glucose reserve for energy needs. The main role of bile in digestion is to A. Hydrolyze proteins. B. Emulsify fats. C. Activate amylase. D. Absorb vitamins. Answer, B. Bile emulsifies fat into smaller droplets, increasing surface area for lipase action during fat digestion. Which vitamin toxicity is most likely due to fat-soluble storage in the body? A. Vitamin C. B. Vitamin B6. C. Vitamin E. D. Vitamin K. Answer, C. Fat-soluble vitamins like A, D, E, and K accumulate in tissues, increasing toxicity risk when overconsumed. A vegan diet may require supplementation of which nutrient? A. Vitamin C. B. Vitamin B12. C. Vitamin K. D. Folate. Answer, B. Vitamin B12 is found only in animal products. Vegans should obtain it from fortified foods or supplements. Which food preservation method relies on osmotic pressure to inhibit microbial growth? A. Drying. B. Salting. C. Canning. D. Refrigeration. Answer, B. Salting creates high osmotic pressure, drawing moisture out of microorganisms and preventing their growth. What is the caloric value of 10 grams of fat? A. 30 kilocalories. B. 70 kilocalories. C. 90 kilocalories. D. 45 kilocalories. Answer, C. Fat provides 9 kilocalories per gram, so 10 grams yield 90 kilocalories. The primary function of vitamin K is A. Collagen synthesis. B. Blood clotting. C. Vision support. D. Iron absorption. Answer, B. Vitamin K is essential for synthesizing prothrombin and other clotting factors. Which organ primarily regulates blood glucose levels? A. Pancreas. B. Liver. C. Kidney. D. Stomach. Answer, B. The liver stores and releases glucose via glycogenolysis and gluconeogenesis to maintain blood sugar balance. A food labeled low-fat must contain no more than A. 1 gram per serving. B. 2 grams per serving. C. 3 grams per serving. D. 5 grams per serving. Answer, C. FDA labeling standards define low fat as containing 3 grams of fat or less per serving. The best indicator of long-term blood glucose control in diabetic patients is A. Fasting glucose. B. Postprandial glucose. C. HbA1c level. D. Insulin level. Answer, C. HbA1c reflects the average blood glucose over 2 to 3 months, offering a long-term view of glycemic control.